Hello, you guys. My name is Miguel Gomez, fellow Xray tech student here, giving you some more knowledge to make your experience easier throughout the program. So, in this video, we'll be covering how your clinicals are kind of like a job interview if you're wanting to get a job at the site you're going to. So, for the most part, you'll be told by your teacher what to expect, treat it like a job interview. And also, I got pulled aside by one of the techs who was a recent student who graduated, and he's like, if you want a job here, you have to just kind of be on top of it, try to clean, try to help around, try to take it as a job interview, especially when the boss is around or in any tech is around, because they'll see that. And if they see you're valuable and they see you know what you're doing, like can help you get a job or at least have a reference, that too. But for the most part, for me, I thank God I was like, as soon as day one, I took it like that, and I'm thankful that I have a job opportunity kind of like secured for me, because this is what I did. Like, I would get there early. Like, let's say my starting time was 8 o'clock. I would get there between like 15 minutes earlier and like have everything set up, make sure there's nothing clean, dirty, make sure everything was stocked up. Like, that was a big thing that the boss and the other techs liked, and that helped. And then also like being able to be friendly, nice, communicate, be like have good like patient care skills. That's another big thing that I like to see. And like like if you see a tech working and you see him struggling or he needs help, without them having to tell you, you go jump in and you actually help them. That's another big thing that will help you. And also, like, I know as students, we'll get nervous trying to do exams, but the more exams you can do without them actually assisting or asking for help will kind of seem like, okay, he knows what he's doing, he's knowledgeable, he knows his stuff. That's another big thing that's useful. And then knowing your way around the hospital, because sometimes they will tell you to go do some things or pick up some equipment. If you know the basic layout of the hospital, that's another big plus. And also getting along with like not just the people in the X-ray department, but also being nice and friendly to, let's say, the RPAs, the radiologists, the nursing, or anyone else who works in the medical facility. That's another big thing that they like to see. And also, like, absences, try to not have too many absences, try to be there consistent, because clinicals is kind of your job, kind of in a way. You're not really getting paid, but like being there consistent. Don't be that one student that like will take one X-ray and then just wander off and they don't know where you are. That's another big thing. Like, if you're gonna leave to go somewhere, make sure you tell someone, because I remember one time I was with an X-ray tech, but I didn't tell anyone else I was leaving to go do exam, like some portables with them. So like the manager thought I was, maybe skipping, or I was just, they didn't know where until they actually called the X-ray tech, and he's like, no, he's been with me. So like I had an alibi, kind of. So that's another thing. Communicate, and also like when there's exams, being printed out, try to be the first one to grab it. Try to always be productive, and like make their job easier, so they can see that you are a team player, you're willing to work, and stay aside from drama. You don't want to be that one student that always causes drama or always fights with the techs or like be arguing. That's another thing that you should kind of stick away to. And I know with certain X-ray techs, they'll, depending on how they are, some of them you'll get along so well they almost feel like your friend, but you try to keep it respectful, keep it professional, because at the end of the day, they're your student, they're an actual X-ray tech, so if something happens, the one who will get affected is us mainly, not as much as them. And let's see, and being like also friendly to the patients, that's another big thing. If they see that, like, if something happens, like let's say the patient is feeling nauseous, vomit, if you know, like, okay, I'm gonna go get something to help, like either get some medicine, well not get some, you really can't get medicine, but like get like the little baggies for them to throw up, or like to see that you're actually doing good patient care, or like if the patient's in pain and struggling, you're able to be quick on your mind to know what to do. That's another big thing, because I've seen some students out there when like something not common will happen, they'll like freeze and they don't know what to do. You have to like be smart and be like alert and know what to do, and always be knowledgeable and know like what everyone else is kind of doing. So like, because there's no point of us going to, let's say they're gonna go do a portable in one view, there's no point of like two students going over there with them, because like it's really only a one person job, when back in the main department, you know, some other big things going on. It's more better to go, like, know where you, yes, go help, but like know where your help, it'll be more useful to them, because sometimes they do get like stacked up with like a bunch of exams back to back to back to back, and like you want to be as helpful. Like for that example, if they're stacked, like some of the times it will kind of push you a little bit to the back. They'd be like, okay, it's stacked, like we have to get these patients done. The Xray tech's like, I'm gonna take over, you know, to do fast. Like in that case, use that as a time to like help them out, as like cleaning the room, changing the sheets, getting everything set up for the next exam, so the Xray tech can just go and pick up the patient and come back and knock them out. That's another big thing. And also be aware of your time. Like when you go on your lunch break, make sure you, like, let's say you get 30 minutes, make sure you come back within those 30 minutes, because if you take too long, like they'll note about that. And also like, don't be on your phone. That's another big thing, because if you're just on your phone, yeah, sometimes it'll be slow, but if you're just on your phone, they'll be like, oh, okay, like instead of being productive, he's just on his phone. That kind of makes you seem kind of lazy and stuff like that. Even though you do see a lot of Xray techs, especially the older ones, they'll just be on their phone. But for the most part, just try to like be a good person, be productive, try to do most and make their job easier. And if they are hiring, hopefully, you know, that gives you a chance, especially us without experience. The only ones who actually get to see you work without actually really working your license is the people of your clinical, and especially without experience. So in certain places it's more harder to get a job, and the ones you can go to are your sites, because they've seen you work and they can more easily know how you work, and it'll make the job experience more easier. And also, like, you won't be nervous going to work, because you're like, okay, I know these people, I know what to expect. And that's another thing, it'll make it more easier for them, because you're like, okay, I don't have to train him, I don't have to, you know, give him some rundowns of certain aspects of the hospital, because he's been here like 6 months, he knows everything, we taught him codes, we taught him everything. And it'll be more easier to, you know, if you're smart and you're good, like to hire you, instead of like getting another Xray tech who, yes, he knows some stuff, but he is not familiar how everything works in the specific hospital. And yeah, I hope this helps.